you have a patient that's newly diagnosed with esophageal cancer, the first thing we have to do is complete the staging evaluation. And there's several tests involved in the staging evaluation. And once we have all the staging completed, that'll give us a better idea of how we're going to treat this cancer. For relatively early stage cancers, where the tumor is relatively small and localized to the esophagus, sometimes you can treat those patients with something like an endoscopic procedure, where the gastroenterologist can go down and actually remove the tumor endoscopically. Those patients afterwards will then have very close surveillance to make sure that the cancer doesn't come back. If the tumor is a little bit larger than that, but does not involve lymph nodes, then surgery would be the preferred option. For cancers that are very high in the esophageal tract, sometimes surgery is not feasible on those patients, and so those patients would have to be treated with something besides surgery, and usually that means chemotherapy and radiation therapy. For most of the other cancers, again, if it's a relatively early stage cancer and does not involve the lymph nodes, surgery sometimes is our primary modality of treatment. If the tumor is a little bit larger or it has spread to lymph nodes, then usually we're looking at multimodality care. And what I mean by that is that there are a lot of different doctors involved in the care of those patients. Quite often we do chemotherapy plus radiation therapy first, and then it's followed by surgery. And there are also other approaches where you do chemotherapy alone without radiation, then surgery, then more chemotherapy again after the surgery. Those different approaches are considered to be equivalent. Patients who are stage 4 where the cancer has spread, in general, we're looking at systemic treatment. We're looking at treatments that will go everywhere in the body rather than something like radiation or surgery that's focused just on the esophagus. So when we talk about treatment for stage 4 cancers, we're looking for something that's going to go everywhere. And that usually means what we call systemic therapy. Nowadays, systemic therapy consists of chemotherapy and usually involving immune therapy as well. Now, when the cancer has spread, your doctor will normally test for a variety of different markers or different proteins that are expressed on the tumor that will help to guide therapy as well, because it'll be chemotherapy plus one of these what we call targeted therapies, or chemotherapy plus immunotherapy, and those would be the standard approaches to treat this kind of cancer. In my experience, it's a lot easier to get the tumor profiling when the patient is first diagnosed. Cancer has been biopsied, and then we can send the tumor off for profiling. We then make decisions based on the staging and do further treatment based on the staging. If the staging turns out that the patient has a localized cancer, then we don't use the tumor marker information. We just treat them according to the standard of care. However, if it turns out after all the staging evaluations that the patient does have metastatic disease, then we already have the information and we can jump in and get going more quickly.